Slide, of course, has
Sorry, I should have spoke.
reference to our first participant graduation. And sir, thank you for being here. We figured out part of our problem, I guess, so.
Yeah, the battery was not pushed in. So we all have our mics on now, and I apologize that I wasn't speaking into mine when I just gave that announcement. Thank you.
This gentleman would probably decline to announce his name in this context, so I'll just be safe and not mention his name. But he started off as a recovery court participant. When he transferred over to mental health court, we allowed him to transfer over in such a way that his time at recovery court we considered to be, we counted it so that he could transfer over in the same or relatively the same phase, if you know. And if you had had an opportunity to experience dockets with him or interaction with him, what you would discover, I think, is that you would really like him. He's sometimes appears to be kind of fragile to some extent. Perhaps you might discern that he's not, let's loosely use the term normal, because I humbly concede I'm not normal, but he's very creative. He has artistic ability that he displays often. He expresses a lot of what he's going through with his art. He does paintings. They're symbolic, I would say, not necessarily, I wouldn't call what he does realism, but I don't know necessarily that I could pigeonhole it into any style. I'm nobody's idea of an art scholar, but he actually makes significant use of his efforts and talents and does a lot of artwork, some of which is now hanging in my office.
Mm-hmm.
I'm just excited for him, grateful for his success, proud of all of what he's accomplished, and I think I can tell you that you would probably like him as a person. In fact, it's hard to describe him as someone who has a criminal justice system involved past. He's just a nice young man, and I anticipate further success for him. He does have a child. He intends to visit his child in Michigan. We got to work on getting some criminal exposure. I think he's got something that he needs to turn himself in on in something minor in Michigan. So he wants to be able to get that cleared up before he goes to visit his child. But his assistant public defender is working on that in all respects. I'm just really proud of this guy. So that's something nice I have to report to y'all. And my thanks to our very skillful, hardworking, excellent team. Appreciate y'all.
I had a question about the statistics. 15 program participants to date. In our last meeting, you indicated that we had 10 expected as of March 1. So am I reading that then? There's been 5 additional since our last meeting?
That is correct.
Okay.
Yep, sure is. And in fact, one of them, our very latest one, was just today. So I literally just got the participation order emailed over to me just a little bit ago. So, and out of the 5 assessments, there's one that we feel would be a good candidate. But again, we'll have to have staffing and do a team determination on that. But moving right along.
And so there's, do the numbers feel manageable? Do you feel like we have the resources to cover those participants? Do we feel like there's room to grow? And if so,
That's an excellent question, Council Cooper. And in fact, my team, staff, we had a discussion about that earlier today. And, we can have a further discussion upon it, but we do feel like 20 is right now, looking at our existing active and current participants with our 2 case managers, our case manager and clinical case manager. We hope to bring on an intern soon, but about 20, especially when we look at the budget we spend the majority of our funds towards that special assistance. And that's key and very beneficial because we assist them in 4 main categories, and that's housing, medical, food, and transportation. And so that can be pretty cost extensive for an individual if you're going to help them from phase 1 to at least 3. So we're feeling like 20 would be a good fit for us, but we'll take a closer look at it. But we just discussed that today. That's why I said that's a great question. We literally just had that conversation today. So, any other questions about the stats, the participant admission and referrals? Okay.
If I could, I'd like to move on to an agenda item, the drug and alcohol testing services. And I honestly forget if we have mentioned this to you before, but Casey discovered a need, and we discovered that we had a need for participant drug and alcohol screening in our mental health court program. And that was discovered pretty early on in our providing services to participants. Interestingly enough, we as a result discovered that other agencies, including our specialized or problem-solving courts, and our criminal courts and sessions courts and probation, we all had a need for drug screen servicing. And so I want to applaud Casey and her initiative and thank her for working to find a solution. And we also worked hard with Mr. Myers and Heather Whitehead from procurement and Jill Rosenberg, Jessica Johnson from the Knox County Law Director's Office. And I just can't thank you guys enough because we were able to contract, or we're about to contract with Aber Health. I think that's how they pronounce it. They've been used in 17 other courts or agencies across the state of Tennessee. This is going to be a beneficial situation. They're going to be providing drug testing services to not only mental health court, but recovery court, veterans treatment court, and our probation, county probation. And just thank you guys so much. This is going to be a significant improvement in the way we provide services. They're going to be able to test folks in several different locations, or at least a couple different locations, including in court if needed, that kind of thing. So, and it's going to be on Knox County's agenda to be approved Monday, May 20th. This is a very positive development. I'm really excited about it. And is there anything I've missed, Casey?
No, I don't think so. I think, thank you so much. As he had mentioned, we just wanted to recognize the 4 individuals he listed for their stellar steward for the county. And we have some thank you cards for them, if you wouldn't mind to, not knowing they'd be here. If you guys wouldn't mind, it's a small notion, but they've done a lot of big things for us. And so we are very appreciative for their patience, flexibility, and positive attitude during this process, because they were able to fast track and help us get some things done. And so I'm very thankful. So if you guys would sign those thank you cards on the way out, that would be very much appreciated. Does anyone have any questions about the new service?
When does it start?
Fantastic question. So assuming that it's approved, the Aber Health has claimed that they need at least, they're going to try to fast track it as well, because we would like to start July 1. It may get a little bit closer to August 1. They need 60 days to set up their co-locations. So they will be using a facility right beside probation, which is on L1. There will be one, and then the other location will be at the Liberty or Hill Avenue location where the Recovery Court and Veterans Treatment Court is located. So there'll be there's 2 individuals that they'll retain to do that, and they will float between the 2 based upon a schedule that they create. So right now, when an individual reports to court and you guys want them tested, you guys send them down to probation. They scramble to look for someone who's available.
Did that today, actually.
Yes. right now, the way we have it set up, and this is subject to change, is that you should be able to Monday through Friday from 9 to 11 send someone down and know that there's staff down there that's able to do that. There is a one-sheet document that just kind of like outlines the need and scope that we identified and the benefits of having an outside service to do that for us. And that might be helpful if you want to take a look at that. It was just something that we used to share with the commission so that they would be knowledgeable for the need. I think the big question had come from like, well, how are we going to pay for that? Luckily, the need, started through the criminal court clerk services. And so Mike Hammond's office turned over $1.32 million. And so as a result, he had inquired if we could, and we've done that in the past, get the county to help us with that $150,000 to cover that first year. So what we will do in that first year is probation, Richard Major and myself will look at that 1 year, and so that way we can identify the cost. So probation collects fees, so they help pay for their services. Recovery court and veterans treatment courts, their participant pays for fees, so they'll be able to assess how much they need. Yes, yeah, and thank you for clarifying that. Yes, just for that purpose. We, mental health court, do not collect fees. However, we've had communications with our managers, and we absolutely can allocate funds from our budget for that. So after a year of looking at it, we will have a true approximate number of how much funds we need to allocate towards covering those fees going forward.
Meaning going forward in subsequent years.
For 26, 27,
Right.
or 25, 26, because we are covered for 24, 25. So.
We know from staffing that it is really fairly common for somebody to come and have a positive drug screen. We send it off to a lab and it comes back that it actually was negative.
Mm-hmm.
And we know that based upon the data from these instant tests that they're really only about 75% effective.
Yeah.
If we're going to this system where it's now not staff that is going to be administering these tests, is the protocol going to be the same? Is this private company still going to be sending off to a lab
Absolutely.
to verify the...
So all samples are sent off to a lab. They have the ability to do an instant cup if needed. If you need that test result right away, we all have a supply and they have a supply as well. However, all samples are collected and sent to a lab and we have those test results within 24 hours. Okay. So that removes that, and it's in this one sheet or two that kind of like gives a little bit of stats that 1 out of 4 are generally false positives or whatnot. So it will help with that. The other really great thing about it is that currently we're buying already screening that have panels with like 10 or we have 15 panel screening cups. We get to pick. So they're 8. So we can change it from week to week. So for each participant for next week, we can change it if we identify, or maybe there's a trending substance, or if we identify like, hey, let's change it up and test for this. So we have that ability to rotate the panels. That's another thing that's going to be like pretty cool for us. And it just removes that liability. That's one of the things that we have here from us, so that our case managers can focus on treatment and not have that report kind of disrupted. It's difficult when you're providing case management and then you're turning around and you're the individual who's doing screening. So it's not always the case. I mean, sometimes we get our screening results from other agencies like probation or transitional housing or so forth. So yeah. That's a lot of information, but I realized that this is pretty introductory, and so I wanted to provide you guys with as much info as we have. We have their proposal for the winning. We had 4 bids that were submitted. We had an evaluation committee review that, and this EverHealth has won. Their proposal is 44 pages. I'd be happy to share it with you, but it's pretty in-depth, and it was really well put together, which is why they scored so high.
Will you email that to me, please?
I would love to. Yeah, absolutely. I will email that over to you. And if anyone else wants that.
Yeah, I'd like to see it.
Yeah, absolutely. And also, our renewal contract, it's 24 pages. I'd be happy to send that to you guys if you want. It's the same. Yeah. You guys approved the budget last time. So as far as that, those are just the 2 things that will be on the commission agenda on Monday. So.
Thank you.
My pleasure.
That's good news.
Yeah. All right.
This is an example of our mental health board staff, including an especially Casey. Thank you.
Oh, it's a team
Seeing
effort.
a need, working hard to fulfill the need, and discovering that there was a need across our agencies in this jurisdiction, and figuring out a way to end up with a win-win situation. We haven't actually verbalized this. Maybe we should go ahead and create a record. That one of the things that becomes most glaring, and maybe you wouldn't think of it unless and until you have to actually provide a drug screen test that's urine based. You know, our lovely young ladies who serve as case managers are unable to provide testing for males. So, you know, tipped us off right away that we would have to coordinate or cooperate with somebody who could provide a male tester person because these things have to be observed, as many of you probably know. So the need was there, and it was true that we had a need across several of our county agencies now. After Health will be able to provide this testing for lots of different folks, and they'll be able to provide it better, more efficiently, and this is going to be a very good thing.
This might be a great opportunity to thank Knox County Probation Services, Tara Richardson, the director, who was kind enough to allow one of her probation officers to assist us in this interim, a male, to help us with some of our screens. And so we're very appreciative for their collaboration in helping us during this transition until we got something more solidified.
And that was Jack Dennis, wasn't it?
It was. Jack Dennis, we're very appreciative. He's on all of our specialty courts teams. So he's fantastic.
We covered that? All right. Now, looks like if any of you have any suggestions for any new business, I'd be honored to receive your suggestions. Looks like nobody has too much to say about potential new business or other business.
Don't be insulted by that. That's a good thing.
I'm just.
Thank you. I'll take that as a compliment. Everybody have August 16 and November 15 in your calendars. Thank you. All right. Once again, our thanks. We appreciate y'all so very much. It's really, really nice. And my thanks also to Mike Hammond. He has acquired an additional skill of turning over excess fees and reminding county finance, hey, we've got this little need. Can we have 1/10 of what we're turning over? Is it 1/10? I don't know. I forget my fractions, but a small portion of what he turned over can actually fulfill this testing thing and get us started on that. That was probably a pretty brilliant move, and we're very appreciative of all of y'all. Thank you kindly for helping us fast track this. All right, we're at 24 minutes. Is there a motion?
Move to adjourn.
Second.
Third.
You guys, thank you so very much for your
Thank you,
participation.
ma'am. I made it.
Thank you.
I hope,
You did.
I hope it was worth walking